about symptoms and side effects? What should people be worried about?
Yeah. So, I think in terms of, oftentimes when patients come to us with a new diagnosis of head and neck cancer, um, you know, when looking back, they've had sometimes symptoms for a while, whether it's, a nagging ulcer on their tongue or some difficulty with speech or new hoarseness or a lump in the neck that turns out to be a cancerous lymph node. And so, even before we get into the diagnosis of head and neck cancer, I do think it's important for people to know that, in particular, if some of these symptoms, particularly if they're lasting for a while and not going away with, more conservative measures like antibiotics, really need to be evaluated by an ENT and a doctor team to make the diagnosis of head and neck cancer so it can be treated. The side effects of treatment very much depend on the treatment modality that's used. So, for example, when chemotherapy and radiation or chemoradiation is utilized, oftentimes the treatment itself can be associated with a lot of side effects from treatment, things like sore throat, things like skin changes, things like fatigue, challenges with nutrition, and a plethora of other things that, depending on some of the specifics, can be associated, which is one of the reasons why we're trying to figure out if there are some patients that we can de-intensify the radiation or do more precise radiation rather than standard regular dose radiation for everyone. But that's, of course, in the context of some of the clinical trials that are being evaluated for improving outcomes for head and neck cancer patients.